Hello, everyone, and welcome to the Science North podcast, Give Vaccines a Shot, where we'll explore the latest in vaccine news, learn all about the global health pandemic we're facing, and have an opportunity to learn about the importance of our immune system. We'll be doing this all through the lens of our expert guests. This month's guest is Désirée Venne. Désirée Venne is a public health Sudbury and district spokesperson and a public health nurse in vaccine preventable diseases. Désirée has many years of public health experience working in vaccine preventable diseases and has supported the agency's COVID vaccine efforts throughout the pandemic. Just as a side note, this conversation was recorded in May 2022, and some of the facts of the pandemic may have changed. If you have any concerns, please be sure to contact your local health unit. I was lucky enough to sit down with Désirée, and I am happy to be sharing our conversation with you. Welcome to the Science North podcast, Give Vaccines a Shot. We would like to take some time today to talk about the importance of routine childhood vaccinations and why it's still important to consider vaccinating your child against SARS-CoV-2. Before we start, could you introduce yourself?
Sure. Well, thank you. My name is Désirée Venne. I'm a registered nurse. I work in public health, so as a public health nurse with Public Health Sudbury districts, and I do prefer the pronoun she. So I'm happy to be here today on behalf of Public Health. I've been working in the vaccine preventable diseases team there for 10 of my 15-year career at Public Health. So it's a topic I'm very passionate about and happy to address today.
Excellent. How long have childhood vaccinations been part of routine public health policies?
So it's a great question, and I'm happy to bring some of that history back, because back in 1982, Ontario was actually the first province to enact in law making routine childhood vaccinations mandatory. And this amongst the school-age population, obviously, so 4 to 17 years of age. And the goal was to reduce obviously, the prevalence of these illnesses, and they targeted reduction of 9 diseases. So the first 6 to be included were, diphtheria, tetanus, pertussis, and measles, mumps, rubella. And then in 2017, the act was amended and to include 3 more diseases. So meningococcal, pertussis, whooping cough as we know it. And the last, of course, was varicella chickenpox for those children born January 2010 and later.
And why is it a good public health strategy to vaccinate our children?
Yeah, absolutely. So lessons learned, obviously. So there were demonstrated benefits throughout the world with mandatory vaccination programs, for example, in the US. And Canada shortly followed suit in the 90s with demonstrated efficacy in controlling the spread of measles. And so this shortly thereafter led to the pursuit and enaction of this Immunization School Pupils Act, we call it, which requires this mandatory vaccination. So it really is to reduce the burden of illness, the spread of these preventable diseases, and protect the health and safety of children in our communities, of course, for all.
Many of these diseases have low mortality rate and often might not actually have side effects for children. So why do we still need to vaccinate children against these diseases?
This is a very good question, and it's a common one that we get with public health. I think that sometimes vaccines, we joke, are almost their own worst enemy, because they're so effective at historically have been so effective at preventing and controlling diseases that we now have a generation or two that don't particularly remember the burden and the unfortunate impacts of these diseases, such as measles and polio, for example. So if we think back even like 100 years ago, infectious diseases were really the leading cause of death worldwide. And now in Canada, they cause less than 5% of deaths. And that's thanks in part to immunization programs. So if we think that without this effective tool, if we sort of pulled back and became complacent or chose not to vaccinate, that the worry here, and I'll use the analogy here, that of course we have high protection rates in in our country for these diseases. However, travelers or those coming from other countries where these diseases might still remain endemic may import these cases by traveling into the country. And so if we don't maintain these very good coverage rates and protective rates within our population, the risk is that these diseases could return, infections could spread amongst the population, and again, be difficult for us to control once again and be left with that burden. So there's a really good analogy actually that I read, I found was so interesting, that illustrates the importance. So if we think about how far we've come in preventing disease and illness and controlling it. If we were to take the example of sitting in a boat and it's filling with water, the disease rates are increasing, the burden of illness. We now have a tool at our disposal, which is vaccination. So we're able to, start bailing the water out of our boat and keep things afloat. Now, if we were to start gradually pulling back on that measure, stop bailing the water, well, of course, the water would start seeping in again, and eventually we'd be back where we were before 100 years ago. So not somewhere we want to be again in terms of public health safety. So I think it's just really important reminder to Canadians that making that decision and vaccinating your children is very important to not only your own households, but thinking about your workplace, your school community, and beyond.
How was a decision made as to which pathogens were going to be addressed with vaccination? Was this something that was done locally, or is this a worldwide sort of thing that was decided?
Yes, traditionally vaccines, the development of vaccines and the pathogens for which they were developed obviously were spurred on by the response for the burden at the time for disease and illness. So as we know, polio, very debilitating, causing paralysis, etc. Smallpox, as you mentioned, that worldwide global effort really, it took decades. However, we're successful in eradicating smallpox, as you said. And then as we move on, as you mentioned, polio, which we do know that are still some wild cases of polio in existence in the world, and which brings back the point of importance of immunization here locally and within our country. But as for other diseases or emerging and so on, goals in Canada for vaccine or pathogens that are targeted, they're done collaboratively. They're done in an evidence-based manner with provinces and territories, along with research and recommendations from worldwide organizations based, of course, on disease epidemiology, disease burden, and risk-benefit ratio, of course.
You had mentioned that the most recent one, I guess, was chickenpox for vaccinations, and I know that my children have been vaccinated against chickenpox. I contracted chickenpox as a child and then actually had shingles as I was older. But my children, because they're vaccinated, did not get chickenpox. Are there other diseases most recently that have been added to the list that we are now vaccinating against? Are there any other more recent ones that we are vaccinating against?
It's an interesting question. So in terms of childhood vaccinations, varicella would be the most recent and last addition to those mandatory vaccinations. There are, of course, travel vaccines to protect. In terms of adult population vaccines, one that we often forget, and it's not that one that's added, but I'd like to just really take the opportunity to promote. So as we mentioned, vaccination has helped control pertussis, which is whooping cough. Quite debilitating, causes quite severe respiratory distress, coughing to the point, of this whoop bark, to the point of vomiting, can be quite severe in young children and infants. So it brings the point that the goal of immunization also is to ensure that our general population is well protected for diseases such as pertussis, which would then ensure that those who are most vulnerable, such as infants and older adults, are well protected, and so knowing that they are susceptible to severe disease. And so as for more emerging illnesses and diseases, the most recent example, obviously, is COVID-19 response and the vaccinations that were made available and expedited in a safe and effective manner, I should stress. And so that really is the most recent example that I can bring to point out, yeah.
And then my son's in grade 7, and he had vaccinations, I guess in the in the fall. It was around the time that we were having we got vaccinated for the flu, and then at the end of that week he actually ended up coming home and saying that he had 4 more vaccinations that he had to have. So one of the vaccinations he was one of the diseases was, or I guess the vaccination was HPV. So the
human papillomavirus. Yes.
Yeah, and from what I've heard, that has been a very effective vaccine in preventing cases and reducing cancer risk as well too, right?
Yes, and I apologize. Thank you. I should have noted that one. Most certainly, it is one that we are quite proud of. Myself personally, to be able to provide as a public health nurse too. It is offered to grade 7 and 8 students here in Ontario, publicly funded, so at no cost. It is given in a 2-dose series for that eligible population, and it is very effective. And I'm proud to say and share and tout that it is a cancer-preventing vaccine. So human papillomavirus, many strains of it cause genital warts, other afflictions to and neoplasias within the cervix can lead to cervical cancers and growths, as well as genital cancers and men throat cancers in both sexes as well. So it leads to the importance of the vaccination is that it's only effective if you offer it prior to exposure to these viruses. And so many of them, you can become infected, show no symptoms. However, you still carry the risk of further deleterious effects and risks of cancers from exposure to HPV. And so it is very important to offer that vaccination, which has been very effective in providing protection and reducing the incidence or rate and development of those cancers in our young population.
And had the school vaccinations been halted during the pandemic for the past 2 years, or were they continuing to happen in Sudbury?
Yeah, so actually I'm happy to share that we're quite busy at this time due to the pause, of course, in our programming. So as the COVID pandemic arose, of course, our resources were shifted, of course, to respond to that novel virus and to control its spread and protect our community. With that said, we had to pause all of our routine vaccination programming. And so just as of the new year, I would say April or so, we've been out in schools resuming those grade 7 vaccination campaigns. So we're offering hepatitis B, HPV 9, so Gardasil 9 vaccination, as well as protection against meningitis, meningococcal disease. And so we're proud to be out there right now catching up these students. And just a reminder to those, if they're not sure, they can certainly reach out to us at Public Health, review your records, and we can advise what your child might still be overdue for.
A concern that parents often have is about side effects, short-term side effects, but also long-term side effects. So are we confident that there are no long-term side effects from vaccination?
Yes, very confident. I must say that Canada, we should be very proud of our robust surveillance and monitoring system. We know that vaccines are tested extensively. We have a system within Canada that is collaborative, includes multiple stakeholders and partners. This would be government, of course, healthcare providers, Public Health Ontario, which is the organization or the agency that collects information on adverse events following immunization. Those are very stringently reviewed, recommendations are made, reports are then published, also available to the public. And so the surveillance and monitoring, I should also stress, is not only begins at the beginning phases of vaccine development, but continues really through the entire lifespan of the use of the vaccine and after it's implemented in our immunization programs across the country. So any vaccine signals, alerts would certainly be immediately followed up on, and any concerns would be then addressed, of course. But vaccines, I must say, have shown a long-standing history of being very safe and effective. There would be, I guess the pressure is on vaccines is that they're given to an otherwise healthy population. It's a preventive measure. Yeah. And so there is a lot of, pressure to maintain that confidence in this intervention and tool. And so, yes, there may be the risk of minor side effects, which I should remind are expected. We are not surprised oftentimes for some of the common reactions we may see, localized, maybe some overall fatigue, nausea in some cases, headache. Most of these are expected and resolve quite well. What we do, however, surveil and report on diligently as part of my role at public health as well, is any of these adverse events following immunization. So things that would occur that may not be necessarily related to immunization, however, can't be ruled out. These reports, healthcare providers are encouraged and told and supported in reporting those adverse events to public health. And same with members of the public. If they feel as though the side effect or the event or the symptom that they experience following immunization warrants some concern and they'd like to consult, that's something that public health is also available for, certainly via their healthcare provider if they chose as well.
And I'm sure that accommodations are made for anybody who has any concerns for any type of vaccination that is being happened. So if they have needle fear or sensory overload type things, like there will be a way of accommodating
Yes.
people that need to be vaccinated and might have special needs.
Absolutely. We're proud to offer our services and make them as accessible as possible to those with different needs and abilities. And we encourage you to visit our website, phsd.ca, or call us to explore those vaccination opportunities. And we also really intend to ramp up and make vaccination opportunities more available to those with perhaps access issues, transportation. So we're looking to work with our partners, with the city, to use community space such as schools where we can set up our clinics as we've done in the past, promote that availability and encourage parents and children to come out and get and review their records even if they'd like and sit down and we'd be happy to vaccinate. And we're very cognizant also of some of those sensory issues and we're all very well versed and ready and able to accommodate that.
Are we are we still encouraging parents to come and get their children vaccinated?
Absolutely. So it's never too late. So even though, yes, we are shifting and transitioning here from the pandemic, sort of winding down, some may say, as the summer months are coming, it's never too late to vaccinate, and the importance remains as the rates of COVID-19 still remain fairly high in our community. And so what we want to do is ensure that children have the best opportunity to engage in their activities, remain in school learning. We know that children do have the tendency to spread the illness even with minor or no symptoms. And so it's really paramount to ensure that they're protected, thereby reducing the risk that they may spread it in the school environment, ensuring that staffing shortages within the education system are not so much impacted and kids can remain in school for their own emotional and mental health as well. And vaccination is absolutely safe. We still have vaccination opportunities available in the community at our Paris Street locations. We are proud to still have our mobile bus that will be out over the summer months, so stay tuned for locations and availability. And we do encourage, come on out for your first dose, second dose, whether it be your booster, and please ensure yourselves and your family and your children are vaccinated and up to date as per your eligibility, of course.
And I assume, although from what I've heard, there might be incidences of flu that is increasing right now, but I guess if flu vaccination is also encouraged in the fall for children as well?
It is, absolutely. So children age 6 months and older, and up until there really is no age cap for influenza vaccination. It really is important to remember that influenza can lead to, similar to COVID-19, grave consequences and disease in some of our most vulnerable populations. So remembering those that can't be vaccinated, they're not eligible for age. So for example, those under age of 5 at this time. And so it's really important to protect the overall population so that, just to give those a chance that, don't have the option right now to be vaccinated. So it certainly is available and we encourage that. Well, actually, along with COVID-19 vaccination, of course, as you mentioned with this first reported influenza case in our community that we were discussing, influenza vaccination is also available at any of our clinic locations. Yep. And healthcare providers do have the option and have the ability to order that vaccine should you feel more comfortable, for example, accessing it there.
So the flu that you said we had our first reported case of influenza. We are now May. Is this the new wave of influenza that's coming through, or is this because normally our wave of influenza sort of comes in the fall. I was vaccinated in early November, so.
Correct. So with our response to the pandemic with COVID-19, obviously the measures that we put in place in terms of masking, social distancing, vaccination, specific to COVID-19, but all of those other preventive measures that we put in place have really helped to reduce the incidence of all, I would say common cold viruses and other respiratory or droplet illnesses. And so as a consequence, we've seen less and have less reported cases of influenza as an unintended consequence, but of course a welcome one. But it still remains important to vaccinate, especially amongst our vulnerable population, healthcare providers, healthcare workers especially, I would stress, and they are highly recommended to receive immunization as they are working with, our older populations and those who are vulnerable in healthcare settings.
One of the vaccines that you'd mentioned was chickenpox, and we talked about how it was one of the newer vaccines that was given. Do you think that this is going to be helpful in the long run with regards to not having to deal with shingles later on, maybe?
Yes, so that's one that we talk about in the clinic as part of my role as a public health nurse, and many people are often surprised to learn or to make the connection oftentimes that so varicella caused by the herpes zoster virus, once that you recover from, say, childhood chickenpox with the rash, fever example, that virus unfortunately does remain dormant within the body, and later on in life, we don't always know why, but with advanced age sometimes, immune suppression due to stress or medication, sometimes stress due to life or whatever it might be, this virus can sometimes reemerge, but it presents not as chickenpox, it presents as shingles. So this very itchy, burning rash that can present on any part of the body.
And it can be quite painful as well.
It can be quite painful. We've seen and heard reports of herpes zoster of the eye, so ophthalmia, so around the eye area, the scalp, anywhere on the face can be very debilitating. It can also lead to blindness. Varicella can be, most people perhaps forget, it's touted or sometimes presented as a harmless childhood illness. However, prior to varicella vaccination campaigns, we saw much higher rates of hospitalization as well as severe complications such as encephalitis from varicella illness. We must also remember too that with varicella, you're developing a rash, which leads to open sores, itching, scratching, more opportunity for infection to set in, and in some rare cases, unfortunately, even cases of group A strep bacteria, which can be a very serious infection of the skin. So it really is a no-brainer in my opinion, but the risk for benefit ratio in terms of varicella vaccination is very apparent. So the more that we reduce the incidence of varicella in the community, even if some are less than protected, as an adult, it would reduce your risk of catching varicella, which at that time could be very serious, as we know. Varicella disease oftentimes can be more serious, the rash, et cetera, and the symptoms as an adult or teen. So very important to vaccinate in childhood and to avoid that altogether, and as a bonus, avoiding shingles as an adult.
And there is a vaccine for older adults against shingles now as well.
Correct. So adults of this generation, most born, I would say, after 1945 or prior, would have been exposed to wild varicella, so prior to immunization campaigns, and therefore carry the virus or at risk of developing shingles. So yes, we do have the Zostavax as well as the Shingrix vaccine, both effective against prevention and resurgence of that shingles rash.
We'll wrap this up, but before we finish, what is the most challenging part about your work?
Oh, great question. Great question. Oh, I would say it's become more apparent, obviously, in the last 2 years, but vaccine hesitancy has been a challenge for sure through my work at public health, but one that I welcome because as public health educators and scientists such as yourself, it's really important for us to use our voice, our knowledge, in order to educate and remind people of the importance of routine vaccination. What it's done in history and how it's changed how we live and what we sometimes take for granted. And so I think it's a great opportunity to remind people and to educate about the benefits of vaccination, remind them that we don't want to be going backwards. Certainly there are exemptions to immunization that are available for religious, conscientious, or philosophical beliefs, and of course for medical reasons. But we really want to bring the message back to encouraging parents and caregivers to reach out evidence-based information. We really want people to make informed decisions because those are the most important decisions you're making for yourself, your family, and the safety of the community as a whole.
And what's your favorite part about your job?
Oh, my favorite part. My favorite part, I would say, is getting out to the school community clinics. Absolutely. I just really enjoy working with the kids, getting them laughing, soothing, trying to reduce that anxiety, of course, that we oftentimes see with immunization. And just I get a bit of a kick and some gratitude out of working them through that fear and then celebrating them with them once they've been able to complete the vaccination and saying, good job, you're protected.
Thank you so much for joining us. Thank you for your expertise. It has been greatly appreciated.
Oh, you're so welcome. Thank you for having us.
Thank you so much for listening. See you next month where we'll explore something new in the world of vaccine science. We also want to know what questions you have. If you have any questions based on this episode or about vaccines, viruses, or the immune system in general, please reach out to us and use our email, vaccines@sciencenorth.ca. Also, follow us on Facebook, Instagram, and Twitter. And if you're listening or watching on YouTube, please be sure to follow. Lastly, Give Vaccines a Shot is funded through financial contribution from the Public Health Agency of Canada. The views expressed herein do not necessarily represent the views of the Public Health Agency of Canada.